I welcome you all on Dr. Reena's Physiology, and today we are going to study a case-based study. The topic which I have selected is cerebellum. So I'm going to start the study in the form of a case, and we will be trying to cover this cerebellum in 2 to 3 lectures, making it short and sweet so that it percolates into your mind. So please share the group as well as the channel and take advantage of the notes in the group Telegram group, that is Physiology Synapse to Success. So let's make physiology easy for everyone. Now you know that you get cases, and this case is a big LAQ also. Sometimes it can also come in the form of a short answer. But the very important thing is the diagnosis and then writing about it. Now, this case says that there is a woman, yes, there is a 34-year-old woman who is having a long standing history of seizures, epileptic seizures. She is coming to the neurologist with difficulty in walking and coordination, and she is being on phenytoin for several days, after which the drug was switched. That means from phenytoin to valproic acid. At the level of first MBBS, don't worry about these drugs. आगे की history सुनो. Now, she has seen that there is a change in her gait. The first thing is a change in the gait. Second is unclear speech. Third is blurring of vision, tremor with movement, and loss of hand coordination. So दो points जो सबसे सबसे important और clear हैं, that is tremors with movement. That means we call them as intention tremors. Loss of hand coordination, that means improper coordination. So these 2 points will help you to click what is the diagnosis. These symptoms were never before. She denies other symptoms like headache, chakkar aana, that means vertigo, ye nahi hai. She is having an unstable gait, hand-eye coordination is poor. She's got nystagmus. She's got fine tremor when she is moving it. Okay, so that means intention tremors, nystagmus, and urine drug screen is negative. She's done a CT scan, a lumbar puncture. Both of them are normal. Now, what could be the probable diagnosis of this condition? What could be the probable diagnosis of this condition? Now, these features are taking us towards the features of cerebellar disorders, intention tremors, loss of coordination. So this is a cerebellar disease. Possibly it could be a side effect of the drug phenytoin that is given to her, right? So the phenytoin levels are normal, are elevated, unless everything is normal. She's diagnosed with cerebellar ataxia. This could probably be a side effect of phenytoin. So first year में definitely drugs के बारे में don't take any botheration. What is important? Loss of coordination and fine tremors, because you have to distinguish this from Parkinson's. Normally the commonest gadbad which is done is Parkinson's is, misconfused with your with cerebellum. So when it is more towards Parkinson, I will also be taking a history of this. The more important thing will be the resting tremors over here, resting tremors, and nothing will be mentioned about coordination. Now, with this point, you must remember what questions can come to you. Which part of the cerebellum is responsible for planning and initiation of movements? So, planning and programming of movements. Is the output from the cerebellar cortex excitatory, or it is inhibitory, or it can be both? And what is the neurotransmitter of the Purkinje cells? These are the probable questions which can be placed to you. In today's video, we are going to have a very short discussion, and I'm going to elaborate the cells and the circuit in the subsequent lecture. Now, so this is a 34-year-old woman with lack of coordination and cerebellar ataxia due to phenytoin. The part of the cerebellum responsible for planning and programming or the initiation of movement is the cerebrocerebellum, that is the neocerebellum. The output from the cerebellar cortex is always inhibitory, and the neurotransmitter from the Purkinje cell is GABA, which also comes as an MCQ, because you know that this Purkinje cells is inhibitory to the deep cerebellar nuclei. Now, when you look on to the cerebellum, right? If you take the cerebellum, now you get the cerebellum in neuroanatomy, you get it in physiology. So let's make it very simple. This is a topic where there is horizontal integration. So whenever you are studying the anatomy and the connections, I prefer that the connections wala jo part hai, it should always be read or studied from your neuroanatomy. Because don't get confused by learning both from physiology and both from anatomy. But the functions, the abnormalities will be all covered in physiology. So you can classify it or you can divide it as the anterior lobe. This is the vermis. The worm-like portion in the center is the vermis. These are called as the intermediate zones. See the intermediate zones. This is the posterior lobe and the flocculonodular lobe. So when we study anatomy, we study this in the different anatomical divisions. That is, the vermis has got the lingula, central lobule, culmen, declive, folium, tuber, pyramis, uvula, nodule, and this is the flocculonodular tube. This is important when you study anatomy, but in physiology, we don't study this. In physiology, we basically have a functional division of our cerebellum. That is, the flocculonodular lobe, which you called in anatomy, is your vestibulocerebellum. These are the lateral zones, which are called as the cerebrocerebellum, also called as the neocerebellum. This is the spinocerebellum, and you can see this is the vermis. This vermis has got the medial descending system. That means the tracts which are more towards the medial neurons or the medial neurons in the ventral horn cells. And if you remember that this medial descending system is mainly responsible to control the axial musculature. Please go through my video of the pyramidal tracts where I have very nicely included this part. And the lateral descending system is the intermediate zone, which is having the lateral descending system. That means fine regulation of the distal limb muscles. Okay, distal limb muscles. So this vermis wala portion jo hai, that is mainly controlling your axial musculature, and the portion which is on either side of the vermis, which we called as the intermediate zone. This zone is responsible for the control of the distal limb muscles. So when we consider our physiology, we divide it into vestibulocerebellum. Vestibulocerebellum is phylogenetically the oldest part of the cerebellum, and it is also called as the archicerebellum. It is also called as the archicerebellum. The function of the vestibulocerebellum is balance, equilibrium. Okay, balance or the equilibrium. Then you have got your lateral cerebellum. That is the newest part of the cerebellum. We also called it as a neocerebellum, and we also called it as the cerebrocerebellum. And iska function hota hai basically planning and programming of the movements. Planning and programming of the movements. Finally, you have got the paleocerebellum, which you also called as the spinocerebellum, and iska function hota hai smoothening and coordination of the movements. Smoothening and coordination of the movements, right? This has got another very important function which is called as the comparator feedback or the comparator feedback servo mechanism. Comparator feedback servo mechanism. So when you are studying physiology and you are writing a question of cerebellum on physiology, please remember that you will have to mention spinocerebellum, vestibulocerebellum, and the cerebrocerebellum. In my subsequent lectures, I'm going to teach you the functions of the cerebellum as far as these three are concerned, and the very complex neural circuitry between the various cells of the cerebellum which are present in the cerebellar cortex. But for now, it was a case history where we could diagnose that it is cerebellum. We could come to know the three divisions of the cerebellum as well as physiologically it is concerned, and functionally we divide. Right? So this is all for today. Very soon, I'll be uploading the remaining part of the cerebellum. Thank you and God bless you all.